So I'm Julie Newman. I'm a nursing education specialist, so a nurse educator. I help nurses prepare to get new nurses orientated and keep up their competencies. And I'm on the patient experience work group. And I'll let Lisa introduce herself.
And I'm Lisa Bungham, and I'm a nurse manager at surgical unit at Methodist Hospital, and I am the co-chair of the patient experience work group. And we're happy to be here tonight to glean some knowledge from you and hope to incorporate your ideas into enhancing our patient experience work.
So our focus really is nurses are with patients in the ambulatory setting, they're in the community setting, they're in the hospital setting. So this is across the continuum. Nurses touch patients more than any other healthcare provider role across the continuum of care. So we take this business very seriously. So with this work group, which is Rochester-based, has the mission to be the world-class leader of patient experience. And by patient experience, it means whatever you think that experience is, whenever. Over the telephone, the portal that he was talking about, that's all about the experience, okay? So our goals are to enhance the relationship between patients, families, and caregivers. I don't know if you've seen the Mercedes commercial for the Rochester business, but they talk about relationship and long-term relationships. We want to also talk about long-term relationships. And so we want to enhance that relationship, and that's what we're going to talk about tonight. We want to improve that patient experience. We want to have a visual reminder that everyone has a role in patient experience as well, and you're a big part of that. So we have two questions that we want to have discussion about tonight. So besides the billing, what are the most desired experiences you wish to have occur each time you're a patient at Mayo Clinic? So you think about the ambulatory setting, you think about hospital experience. What is it about that experience and the relationship that you have with the other on the other side? It might be a nurse, might be a patient care assistant, it might be a desk attendant. Each time you enter into that relationship with us at Mayo Clinic, what would you like to have occur?
I'd like to have the person is like care, really sincerely feel like they're caring about whatever I'm talking about or wherever I'm at.
Mm-hmm.
And listen carefully to what I'm saying.
Okay.
Did everyone hear those? If you want to repeat them, we are recording it, so I noticed you're taking notes.
Okay, oh good.
So you can actually stop taking notes if you repeat the questions and everyone keeps talking.
Okay, so what I heard you say, every time that you come to Mayo Clinic and enter into that relationship, you want to have someone that truly cares for you. Part of that is listening to what you're telling us. Can you elaborate a little bit more? What does that caring look like? Listening is a good attribute of that. Is there something else what does that look like?
That at that moment, I'm their important subject.
Mm-hmm.
That they really are going to help me through whatever it might be.
So at that moment in that interaction, you're the most important thing to them, and that they are going to take care of you and follow through.
Correct.
I just have to tell you a little story because this reminds me of it. So my husband and I were on vacation last week. We were in a restaurant. We went to several restaurants. And we were assessing the wait staff. And my husband wanted to be addressed as Mr. and Mrs. Newman. What would you like tonight? How is your evening going? And it makes me think of what you're saying. You want to have be that most important person at that time. I'm not comparing that going out to eat and being a patient is equal, but we all are human beings and have that desire to be recognized as such. And I said to my husband, that's exactly what that patient experience is about, call me by my name, ask me what I want, because it's about you. It's about the services you need and you desire. So other things that you wish to have occur each time you're here. Barry.
Well, I always have a couple of things, but one of the things is that when you ask for something, I'll just give you a specific instance. Like, for example, in radiology, a few times I've asked for a lead shield. They didn't provide it automatically. So can I have a lead shield? And instead of saying, okay, that's fine, the attitude was more, well, I don't think it's really necessary because no one else ever asks for it. And yet I know it's a good, personally, I know it's a good thing because everybody tells you to ask for it in the research books. But I'm just saying, sometimes when you run into people, they're not used to it in a procedural way. So instead of being negative about responding back and thinking that that's like a hostile thing, it'd be better if they could accept it and maybe ask somebody or follow through on that. Another thing is,
can we just pause there and I'll kind of say back what I think you're saying in a broad sense. So when you come into Mayo Clinic and have the interaction with a provider or a nurse, you might have an idea and you would like the attitude of that other person to have an open mind to accept and understand what you're asking for because you need that.
yes,
Without question.
Without question.
just to look at it, just to think about it in a more positive way.
And-
Another thing is continuity of care, because very often, and this is a problem in some departments where you can't see the same doctor twice, or you can't see the same even care team member twice. So it becomes more where you have to sort of repeat something. They don't really know you that well. So like anything else, it's better if you have some kind of continuity of care and you don't have, it's not like a telephone thing when you're a child and you have, and you have to go through 6 different people to come to the conclusion, and the 6th person doesn't remember what the first person said. Sometimes I think it's better if you have continuity of care where you don't have to communicate through many different people to communicate what your health needs are. And the last thing was that you get the best qualified person for that particular situation. So that, for example, if there's a particular nurse who has a particular kind of expertise in handling, it'd be best if if the patient who needs that gets it, rather than just having someone who happens to be around for that shift or whatever, or a doctor happens to be there just to fill in. And that's hard to do.
I was going to say, Barry, if you got the ticket on how to figure that out, let us know.
Well, I have some ideas, but that's another thing. But I would like the best person for the patient as reasonable.
Okay, so you said 2 additional things. So that
Continuity of care.
continuity of care.
Right.
So I heard about the concern of repeating your story.
Right, because you can go through nurses, like for example, if I call up for primary care, I'll talk to one nurse. The nurse gives the question to the doctor, and the doctor will then give it to another nurse who's not, you're often not the same nurse, or usually not the same nurse who took the question. She calls me back, but then if she doesn't get me and I call back, I then wind up with a 3rd or 4th nurse, and then if you ask even a slight question about what the doctor supposedly said, they never know because they're so far removed from the original communication. So there's like broken communication, so you're not really getting that consistency of communication across the lines.
You need a care navigator. Yeah.
So someone to help.
So someone that helps them is that, and actually I think that navigator role is something that we're looking into, or care coordinator person. So but continuity is a concern and consistent. So the last one, the right person for the right diagnosis at the right time.
Right, like if someone is a resident and they don't really have the skills to really deal with a particular situation and there's no covering doctor, I mean, if there is another person who maybe they can get maybe another resident who's a year higher, instead of just fumbling through, it would be better if they could get somebody who could actually know for sure so the patient gets the best quality of care at all times when it's necessary.
Good. Okay.
Others. What do you expect when you enter Mayo Clinic?
Honesty
Honesty.
and knowledge.
And what?
I would like people to be knowledgeable. Like the desk people should be knowledgeable about some things, nurse other things, doctor other things, right?
Be be knowledgeable within their scope of practice and their patient population.
Thank you.
How about you? Anything?
I'm not really hearing well enough to hear what's been said. I would help to repeat the question.
So when you come into Mayo Clinic for any appointment or any interaction with Mayo Clinic, what do you expect from those helping you?
Well, I think it's already been mentioned, but I think it's really important that they really listen to you and understand what you said. I also thought sometimes they're not reassuring. I was in severe respiratory distress with an asthma attack. It was in the emergency room. They put me in a room and they gave me something, but then they were gone for 20 minutes at least. And I just thought they should have said, we feel you're doing better, because I'm thinking I couldn't breathe 5 minutes ago and now they leave me alone for 20 minutes and they don't even check in. So I think sometimes they could do a lot more about telling you what they're going to do and reassuring you what they do is.
And maybe the time duration, how long they be gone.
Yep, the time duration and how long they would be gone.
So the time duration, how long they would be gone, narrating perhaps what your plan is for the next 20 minutes, what to expect.
Right, and also giving you the feeling, I mean, you know, it doesn't have to be a long relation, but giving you the sense that they're interested in you as a person rather than that you're just a garden variety cardiac patient that isn't too interested.
You are a good person.
Interesting person.
Interesting. Yes, you're all of that. Okay. I'm sorry you had to feel that way.
You know what would help for me, but maybe I'm the only one who can't hear, is that I have a hearing aid on, but it's not working that well, is if you repeated the question right into the
Microphone? Sure. We can do that. Yep. Thank you. Others? Any other things we haven't touched on that you expect and you hope to have occur when you're here?
Well, whether I'm the first patient of the day or the last patient of the day, no matter how tired or how worn out or how exhausted you are, that you treat me as the last patient the way you would treat the first patient.
So Mary, I think it's Mary. She shared how that she gets treated as great as the first patient on the day as the last patient of the day. So that care is excellent and energetic and pleasant, no matter what time of day, what number of patients you have been during that day.
So I think we better go on for the second question. What behaviors demonstrate that the healthcare team genuinely cares about you as a human being and not just a patient? What behaviors? We're looking for behaviors.
Boy, I think it can be hard to, did you want to hear?
Yes.
I think it can be hard to pinpoint that. I had a community medicine doctor for 22 years before he retired, and somehow he got across to me that he was genuinely interested in me, and that, you know, there was somewhat of a conversation between us. I haven't had that since. It's more, you know, you're the garden variety patient or cardiac patient, and let's sweep you through.
So what I'm hearing you say is that in that conversation, he got to know you as a person and not just that patient.
Right, but there was, I wish I could pinpoint, he didn't spend, you know, more time than with the ordinary patient of that, but he really got across to you that you were a person, you were interesting, there was back and forth,
Back in the back.
So I have two things. One, I have a really difficult name to pronounce, and so it always gets mispronounced, and that's totally okay with me. But I really appreciate it when, like, the nurse calling me says, "How do you say your name?" or "How do I say it correctly?" And just offering that extra hand and that willingness to want to know how to say my name. That just means a lot to me. And then the second thing is if I'm in a room and they knock, and I think everybody at Mayo is pretty good about that, but it just gives that they're entering my space that I've been sitting there for 20 minutes and have made it my space. And so I just really appreciate both of those things.
So that everybody hears. So the first was that a difficult name to pronounce, that the nurse would ask how to pronounce it correctly. And then secondly, to knock before they enter the room or the space. And interestingly enough, I've been having some review of some articles where we need to think about, as a patient, we're coming into your house, you're not in our house. So that's very good. Because you do approach people differently. Okay, Barry?
Okay, another thing that I've seen happen, I don't know if this happened to other people, is sometimes healthcare providers will put in their clinical notes that's on the patient portal or whatever, things that they never even discuss with you. And I find that to be kind of disrespectful, frankly. And but it's happened to me a number of times where the provider will say something that they never mentioned at all. Sometimes they make errors, like they'll say something on your right foot is feeling the left foot, and it becomes, then when you go back to a different provider, they'll always say, you got to go back to the first provider to sort of deal with that. But you can't, because often you don't even have another appointment. So there are things on my clinical record that are just totally wrong and have always been wrong. And you can't really, one doctor I have, who I respect with this, he dictates the note while you're there. So you know what he's going to say. So if you have any question, you can ask something, rather than see some comment on the notes that he didn't say that at all. They just, or sometimes they'll say they did an exam, and they didn't. I've seen that many times in the notes where they'll say they did an exam, they tested your heart and this, and they didn't do any exam. And so you look at these things, and it's sort of like, why?
Are the physicians invited to this group? Next.
We are recording.
No, I think that's a great point, and I think that's something that we can all share. And I think we get into a situation where, that's a fine situation to explore in the future, and maybe that's an example of not being an individualized care situation.
Also, patients. We're all patients, but a lot of doctors are not that patient. And some other providers too, where they get very edgy, and they'll say they're not used to people who ask questions, I think, and they just don't like it, and then they'll put something in their note. Ask a lot of questions, and it's sort of like, gee, and you almost feel like saying, to them back, well, you didn't, we're not very. I mean, there are things that take place in there.
And so what I'm hearing too, Barry, it's about communication.
Right, and like an acceptance of the person who's there in front of them, and sort of a warmth, like they're your friend or your family member with knowledge.
Like receptive.
Receptive, and not sort of feel that there's some kind of give and take, or like the patient wants more instructions on physical exercise, something. It's kind of like instead of saying, I gave him instructions, it was, it depends on how it's worded. Sometimes it's worded partially in these notes. I don't know if other people have that experience or not. I don't know if other people can read the notes. But.
Well, it's almost even about thinking about the patient's feelings, as you're saying. When you're going to read the note, how is that going to make you feel just by the way it's written? It sounds like that's an issue, a mutual respect.
It's a big issue. Or sometimes you make an appointment with a specific doctor, and a substitute will come in and they'll say, okay, I'm substituting for Dr. Jones. It's kind of like, huh?
Yeah, I've
it's
been
my
there.
money, what are you going to be substituting for Dr. And it's sort of like, they don't say, is it okay, or they just come in and say, we're doing this, and that's it.
Yes.
I think, along with Barry said, a new one that needs to be addressed is on the portal. When nurses, it's usually nurses that answer back.
Yes.
And sometimes they're very quick to answer your question, but there just isn't that warmth or feeling. I think that's a new area that's going to be
Yeah, it's the perceived communication and the bi-directional communication and how it's perceived and given.
And when you don't have face-to-face, it's electronic, it's hard to, individuals make different perceptions, and, yep, we can have improvement there.
I still can't hear, so I don't know if this has been mentioned, but the feeling, as a patient, that you are in on the decision and that you are part of the team. I mean,
Yes.
even if it's sort of black and white, if you're given the feeling that you're part of the decision, I think it makes you feel a lot better and part of the team.
How do you think you like to be invited into that conversation about your plan of care? What does that look like?
I think you can ask what your options are. You know, like if you're being suggested to take a medication, you know, do I have any other options?
Mhm. So share options and then invite you to try.
Do you know about that? Do you
No,
remember
I
what question
didn't.
you were on?
We're on the last, we want to go to that last slide.
So sharing options
Right,
is a way to invite you into the conversation to make that decision.
right. Like I had a trigger thumb once,
Mm-hmm.
and they sent me to, I don't know, hand clinic or something, and it turned out that it was a surgeon, and of course he wanted to operate right away. And I asked what my other options were,
Mm-hmm.
and it was, you know, the surgery, cortisone shots, or do nothing, but stop clicking it, because every time you click it, you're re-injuring it.
Mm-hmm.
So I didn't click it for about 3 months, and it went away.
There you go. That's a great example.
And
Very
then,
good.
you know, I like to hear what my options are when they suggest like a medication or something. What are my other options?
What are options? And there should be options. So we want to move to our last slide, and it has a list. So some organizations are looking at, you all probably remember David Letterman in the top 10. Okay, that's kind of the concept, but we're really intentional and genuine and focused on this. What would these attributes, characteristics look like to you? If we said, here's the top 5 things that need to happen every time I come to Mayo Clinic, or the top 10. We kind of talked about care. What does caring look like? We've had some discussion about communication, a little bit about respect. I would say privacy, the knocking on the door. Anything else to add to privacy? What does privacy look like when you're here? Because we've got the electronic environment, we've got the physical environment that we're in. Any other things related to privacy? Or any one of these? Encouragement, know me. We've had some discussion about I'm a person, I'm an individual, I'm not a patient. You can respond to any one of these. Yep.
Who is that famous doctor, Dr. Patches?
Oh, yeah,
Oh,
yeah.
He and Marcus Welby would be a good doctor to have.
Patches and Dr. Marcus Welby.
Yeah.
Yeah,
I
I agree.
I remember that from 70s, 80s?
Yeah, I
70s?
remember him too.
Yeah, but you know, it's kind of what some others went to. I want that person who engulfs me and takes me on, and yeah.
And the listening we talked about a little bit.
What do you think encouragement looks like?
Yeah.
I think if a patient is trying to do better, that the increments need to be encouraged.
Yeah.
You know, like if somebody has 150 pounds to lose and they lose 20.
Celebrate that.
Yeah,
Celebrate the small successes.
yeah.
and that positive feedback and reinforcement that you're doing really well.
You're on the right track.
You're on the right track. Okay?
What do all of you think about what safety would look like? How would our healthcare providers exhibit that we want you to be safe?
I mean, it'd be nice if someone washed their hands in front of me, because I must say, I almost never see that. You know, you're supposed to, but I don't,
Do you ever see them use the hand sanitizer?
occasionally.
Okay. Just want to make sure, because that is important. Okay? That's a good.
You had one? Do you have one?
Same one.
Oh,
Okay.
yes.
Well, one safety issue that I brought up in our PFAC committee, in fact, is the fact that often older people, when they're called in and taken back to a room or whatever, the person is about 3 feet in front of you or 4 feet in front of you rather than walking with you because you're slower at walking. And I think it would be nice to, I mean, that's a safety issue because sometimes, in my case, I try to rush. You can't help it.
That's a great,
Yes.
wow, that's a good one.
To walk with you, going back to what procedure room, appointment room, instead of darting ahead.
It's so simple. How about you two? I feel like I haven't called on you yet. Any of these? Can you think of something? What about healing? What is that? What would that look like?
Barry.
Well, I don't know if this is exactly healing, but I would like to see sort of like a control, like when you do planning, you also have control. It'd be nice if someone ever followed up to see, and they often very rarely do, to see whether or not either the pill is working or whether or not whatever they gave you is effective. Like,
So evaluating the plan of
I
care.
can't tell you, when I was in New York, how impressed I was when I once went to an emergency ophthalmologist, and and then 2 days later, he called to ask how I was doing. Did it work? And I can tell you how few times in my life, both in New York and here, in Rochester, that that's actually happened.
Yes.
Where somebody actually called and said, well, is the medicine working? Did the procedure work? Is there any problems? Do you have questions? That I'd love to see.
So Barry mentioned following up with patients to make sure their plan of care was okay, or the meds are working, or they're feeling better, and how important that is.
One area about the safety, I think a nurse, the people in the room from the staff, should take into consideration to come to visit you. Make sure that they don't introduce you to something that they shouldn't. Because I've been in rooms where they were controlled. When they come in, they don't wash their hands. And I think the staff needs to mention that.
All right, good point.
So are you talking about holding each other accountable to wash our hands?
And maybe making sure it's a good time for somebody to come in and see you, or to, okay.
Any final thoughts? You're being very understanding here.
Well, healing and know me to me go hand in hand because I would like to see the person review and have some information about me before they walk into the room. And right there, they can, if they found, okay, they were in 3 weeks ago with some surgery. After surgery, now I need to see how they're following up, and that's a healing.
Yeah. So what you shared was that they have information about you before they actually meet you, and then can address you appropriately.
Read the record.
Read the record, yeah.
I mean, I almost shudder to mention this a little bit, but I feel I should because it's, I think, important, is that sometimes doctors will say they're doing something because it's the cost-effective way of doing something, and I frankly don't like that, but I've heard it so many times in the last few weeks, it bothers me. Like if they refer you to give an area, instead of referring you to X, refer you to Y, and they'll say, well, that's cheaper, it's not cost effective to do the other thing, or we'll do an MRI of one knee, not the other knee, because the other, it's not cost effective to do both. We'll assume the other one knee is as good as the other. I've heard these things a number of times, and after a while you begin to feel like you're kind of like a coin or money rather than a person. And I think it's important that when people refer, that they ask you, is this okay? Would you rather do it another way? Not always do what's the cheapest, most cost-effective approach. Especially when they keep saying it. And I think that becomes an issue.
So it's concerning to you that,
Are they really caring about the best health care for each individual patient, or are they worrying about cost-effective treatment that's just saving money?
right,
And that's come up a couple of times.
so really what is the best treatment for you as that individual,
Right,
and regardless of the cost? And to include you in that discussion.
Right.
Right.
But there may be people who are the opposite of you too, that like they only want to know, they want to know the least costly. So again, it goes to that treat me as an individual.
Yeah,
Exactly.
Understand what's important to me before.
decisions
You
are
make a
made and
decision.
include me
Either
in the
way.
discussion.
Right, either way, because there might be another course of action that might be cheaper, and maybe somebody does care about that. She's absolutely right.
Which
It's
gets
like
to
your
the,
trigger figure.
yeah, the options, the options that are available to you, and you are part of that decision-making process.
Right.
Yeah.
Yeah.
I'm going to add one thing that I think I've heard through all the conversations that have come to this meeting is, and it's communication, but it's also help things be understandable, make them simpler. I just feel like I hear so many of you talk about, I mean, when you guys talk about Medicare, I mean, I don't even want to go there. I'm just terrified.
80, the alphabet of Medicare, yeah.
Right, but like, we don't do anything to help explain
Right.
what people have to do.
Right.
Or to help them. They just kind of leave and then they're off.
My mother-in-law fell over the weekend and was placed in a nursing home yesterday. And I was in the room when a few of our experts were in the room helping her get dismissed. And I'm laughing because it's bizarre to me, but she's 85 and telling her that she needs to call this number when she gets to the nursing home because she has supplemental insurance and they're going to need to talk to her. I mean, nothing. It went from here to there, and I'm in the doorway. I'm not being addressed. I was not even included in the conversation. That's what keeps me coming back to groups like you and to do my work here, is that this is a big, huge learning curve for all of us, and we need to work together. And so I agree with you, the Medicare piece and the insurance piece, especially when we're compromised with health, that has to be in the forefront.
And even we hear it in our office sometimes, even help me understand this place. So, I think it was
Right.
you that talked about
A navigator.
Yeah.
Where Shonda, you can probably add more too, like common things that our patients come back to us about over and over and over. And it's a hard, complex system. Healthcare is hard, but mail is also hard, like just to get around and where information is. But the thread that's through all of it is just simplify everything.
Yeah.
Well, we'll probably close, and I appreciate all your thoughts, and will you invite us back, please?
Yeah.
Because I think our relationship with you in this group is going to be key moving forward. I'm sure, Julie, you agree.
Yes, no, I agree completely.
Yes, and I started communicating to people like Fred Wills, who heads up the Bergs.
Yes.
So we're also reaching out to bring some more
Yes.
people into the meeting so
Yes.
that we have like a variety of patients.
More
that we can,
robust.
tap on. And I met yesterday with Center for Social Media, and I think in maybe one more meeting, I'll be able to live stream these in our community. So we can actually be engaging with people who are abroad or somewhere else and live, which could be really cool.
That's exciting.
Yeah,
Yeah.
so
Yes, thank you for assisting us, because
you guys are awesome. But I seriously, several aha moments in tonight. tonight's meeting. Fantastic.
Thank you, Fran.
Oh, thanks.
Thanks for helping us out.
I'm gonna turn this off.